So we'll start with today's session. Okay. So let us start with today's remedies from Nash Therapeutics, Leaders in Homeopathic Therapeutics by Dr. Nash. And we are so far discussing acids which are mentioned in relation to each other by Dr. Nash. So today we'll discuss three acids which are very important, and Dr. Nash mentions them in one page each. But whatever he mentions is as good as gold, because anything that he writes is of valuable importance. He quotes Herring, he quotes Allen's Encyclopedia, he quotes Hahnemann, he quotes some cases that he has seen. So he brings everything together, and I am glad to see some new people joining today. Dr. Abhishek Yadav, Dr. Rajeshri Patil Razi, you are there always. So good to see your enthusiasm to learn about what Dr. Nash writes in his book. So let us continue this journey of Nash therapeutic study streak. And the first remedy that we'll take up is nitric acid. So, what does Dr. Nash write about nitric acid? And he mentions the first line is that most effective antidote to the effects of allopathic dosing with mercury in syphilis. Now, you need to understand when an author writes a book, at what period he writes the book, what is the situation of medicine, and what are the latest advancements at his era, in his era, at his age. When Dr. Nash was learning homeopathy, practicing homeopathy, many new discoveries were on the way, and some diseases were overdosed with lot of medicines, allopathic medicines, or some herbs, or some which are chemicals and ointments and suppressed with all those things. And these homeopaths, what we know, what we read, Dr. Clark, Nash, Dunham, Jhar, Gunsi, Lippe, all these were fortunate people because people were tired with allopathic dosing so much that they saw the effects of bad uh, you know conditions developing from those medicines. And to explore something that new system of medicine has come up, people used to flock to those homeopaths. And that's where he has written, Dr. Nash has written, that there is allopathic dosing with mercury in syphilis cases where nitric acid can be given. Today also, we have a lot of resources to build a good practice for us. And if the patient is well educated and aware of the side effects that is created by the allopathic school or the other schools of thoughts, they will land up to homeopath. In such cases where the overdose has been given, it may not be a case of syphilis as we saw in the source books mentioned for nitric acid, but it can be anything else. Overdosing by allopathic medicine, especially antibiotics, we will see that nitric acid is working well or may antidote well. So, any such case that comes to you and tells you that We took 3 to 4 rounds of allopathic medications, and those were antibiotics. Higher antibiotics were given, but it didn't help. Nitric acid is the remedy that we should employ. So it is a kind of a corollary theory, just like how we have in maths. Something is equal to something, and hence this also will be equal to this thing. So if you are able to understand this analogy, your clinical practice will improve 10 times better. Nitric acid is one of the medicines which Dr. Nash mentions in the beginning for allopathic dosing with mercury in syphilis. However, now we see it is useful in any other case also from allopathic overdosing, especially antibiotics. And he also tells that nitric acid is not the only medicine, but calcarea and heparin sulf can also be employed provided the symptoms match. And nitric acid, Dr. Nash mentions, has a great affinity for mucous membranes where the skin and the mucous membranes, outlets of mucous membranes where the skin and the mucous membranes join, like the corners of the mouth, the nasal passages, the anal region. Patients or the provers often presented with ulcers with dilism, gums swollen, fetor oris, bad odor from the mouth, and the corners cracked. Normal case of mercury, like we see in our practice. But if merc is given and there is no benefit, nitric acid is the first remedy that should strike your mind even before analyzing something. So, all those cases where you fail with mercury as a remedy and you want to back it up with something that is going to be helpful, nitric acid is the remedy that you should 110% think of. Okay, now the nitric acid action is so wide from the mouth to the throat and also the anal region where it is fissured like ratania, and the hemorrhoids protrude, crack, bleed, and are sore. Even though the stool is soft in nature, the patient will tell you that I do not have to strain, but my pain persists for 6 to 8 hours. Sometimes the patients will tell you that I pass the stool and the pain continues for 6 to 8 hours long. This extension of pain from the passage of stool, the time from they pass the stools to the time that they are doing something else in their lives, maybe at work, maybe traveling, maybe at home doing something else, but the pain is still there in this entire process beyond 1, 2, 3, 4, 5 hours. Nitric acid is the remedy that you should think of. Ratania is also another remedy. The only difference that you will have to make is Ratania will have more or less constipation. Nitric acid may not have constipation in some cases. In some cases, there will be constipation, but the nature of pain and the modalities should differentiate the two remedies. Another two remedies to differentiate is Nux vomica and Merxol. So Nux vomica you will differentiate in such cases of hemorrhoids or fissures by great relief of stools. Great relief by stools. So if patient feels better by passing of stools, you think of Nux vomica. And patient has to again and again go. It's kind of a tenesmus, an unfinished feeling with an unfinished sensation in the anal region. You can confirm it from the patient about this particular symptom. Merck Sol can be one of the remedies. But patient will tell you that I passed the stool only once, but the pain continues for 6, 8 hours, 10 hours, 12 hours. Entire day I can feel the pain which is going on in the background, that should be nitric acid. So once you know these small things that keep coming in different patients, you will be in a better position to prescribe. Nitric acid, you can think of pricking pains as of a splinter, which I already discussed, and the hemorrhage which you will see is bright red. The person is dark complexion, the hemorrhage is bright red. You can find this irony or kind of a opposite type of appearance in the nitric acid patient, and that's where you will see that nitric acid will be suitable for all such cases where they have bleeding hemorrhages, especially bright red, but the person is dark complexion. Trio of condylomata. So nitric acid is given by Dr. Nash in one of his trio of condylomata with thuja and staph, and trio of odor, which is benzoic acid, again urinous odor, and nitric acid will have horse like urine odor, and sepia will have offensive sour odor. Now, just verbally telling about these odors will not make sense until and unless you know how does a horse urine smell like. How is a urinous odor smell like? Public lavatory, especially India, where some public lavatories are not maintained well. You will find the urine odor persisting as a stench for some distance away from the public lavatory. That is benzoic acid. The patient will tell you that my urine smells bad as the public lavatories that we visit. And horse like urine, you may ask the patient, but you will also need to understand it from visiting such stables. And if there is just a plain mention by the patient that there is urine is offensive and sour, you can think of sepia as a remedy. So in such cases, you can think of say sepia and the trio of urine odor which Dr. Nash mentions. So he finishes nitric acid with just these few points, and next he moves on to sulfuric acid. Again, another remedy which has aphthous affection of the mouth, effective in debilitated subjects and in children with marasmus. Sour stomach, especially remedies like iris, rubinia you will find, or sour vomiting. Lot of hyperacidity patient, hyperchlorhydria patients, you will see them mentioning that khatta khatta lag raha hai. This bitter or sour feeling all the time you will see in sulfuric acid, hepar, rheum, magnesia. So, Dr. Abhishek, you have asked a nice question which I appreciate. And sour urine, how to ask or analyze? At times, you will need to ask patients if they know the nature of their urine or the odor. If the patient may not know, the relative will tell you that the urine smells really bad. Sometimes the patients are well aware of the type of odor of urine, sometimes they are not aware. We cannot stick to that. The more flexible we are in understanding what points are available from the patient we collect and prescribe on it, the more faster we become as a prescriber. It's not about being fast and quick, it's about getting the information whatever is available, because sometimes the patients are not aware of all the information that we need, but whatever information is available we collect and we process and find out the remedy. So sulfuric acid, we were at this point where there is sour vomiting, sour stomach present, a lot of hyperacidity in all the patients. Sulfuric acid is one of the remedies that you should strongly think of in averting all these patients away from pantoprazole and rabeprazole and etc., all antacids. Dr. Nash mentions this remedy is mostly seen to act or works well in old torpors. What is old torpors? Someone who is chronic, habitual, alcoholic drinker. And the other remedy he mentions is ranunculus bulbosus. And he also mentions purpura hemorrhagica and hemorrhage like crotalus horridus, like acetic acid, like thuja. Now, apart from that, Dr. Nash mentions that sulfuric acid is a good remedy for all the black and blue spots in the skin, like ecchymosis from bruises. A patient gets hurt and there is kind of a greenish or bluish greenish spot in that area for a long time. That should be your recipe for sulfuric acid. The pain may not be there, but the contused area is remaining that green or blue in nature. Leadenpal and sulfuric acid can be thought. He mentions how to differentiate from ruta. Ruta will act more on periosteum and there will be a kind of a dull pain somewhere within. But sulfuric acid will not have that pain. But only the spot remains or the color discoloration remains. That's where you should think of sulfuric acid. And he finishes this remedy and goes on to the next, which is picric acid. Again, a short remedy, 1 page remedy or less than 1 page. And he tells that this is a new remedy and it requires proving, like he says in many other remedies, because he was at a time when remedies were written, rewritten, proved, and reproved, and data was being collected. I think he was slightly before the age of Clark. So he tells about picric acid. There is tired feeling, weakness of mind, indifferent, want of willpower, desire to lie down. So you will see that all these things, the tired feeling, the weakness of mind, indifference, want of willpower, desire to lie down, will be a part of a student's life when he has to do a crash course of studying all the subjects in 1 month when his exams are due next month. If the patient cannot focus when he is studying well, picric acid is one of the very good remedies that will give them the power. You can give such patients 30 potency twice or thrice a day for a month and you will get good results. If a patient or has headache and also with that there is inability to focus, natrum carb is the remedy that I give. And if he is really good in studying well, but at the exam time he forgets everything, when the exam is there and that day he goes blank, he doesn't know what to do, ethuza is the remedy. If he is good in studying, if he does not have any problem in studying, no headache, no physical issues, no examination funk, but he is kind of a nervous, it can be a part of examination funk, but he is nervous, he remembers everything, but he just is nervous. Argentum nitricum is the remedy. So you will need to differentiate the remedies based upon their sphere of action and their nature as a proved remedy and as a clinical remedy. Then you will be able to prescribe them clinically by differentiating the phases of patient and the remedies side by side. Now next you will see in picric acid there is heavy and tired feeling and there is a feeling of a burning in the back like phosphorus and zincum, and there is brain fag that we see an exertion by headache, which is very similar to natrum carb again over here, but the tiredness and the physical disability is more. So you will see in all the acids the tiredness is more, and if you understand this from all the patients, you will be in a better position to prescribe picric acid. In natrum carb, you will not see this tiredness more, just the physical symptom is present, which is the headache. In picric acid, you will see the physical energy is also down, and there is occipital cervical headache, which is on the back of the head, like natramur and silica. Then he mentions a case, Dr. Nash mentions a case after a lot of remedies. We see one case mentioned for picric acid where there was a kind of a vague feeling in the patient, old guy who was having heavy feeling, unable to focus, and he gave picric acid in the sixth potency and he recovered well. So he tells us that picric acid is a remedy that you can think of in all such cases where there is brain fag or inability to focus, and this remedy needs to be compared with phosphoric acid, phosphorus, gelsemium, argentum nitricum, sulfur, alumina, and silica. So he gives a host of remedies which are very similar in nervous exhaustion to their picture which they present, and it is our job to differentiate. If you have joined late, you can go back and see how my parameters for differentiation of picric acid, natrum carb, argentum nitricum, and ethusa were shared by me. And we finished today's talk on the three acids, which is nitric acid, sulfuric acid, and picric acid. And looking forward for everyone to stay connected and share some good questions like Dr. Abhishek shared today. So keep following Homeo Setu in Instagram, YouTube, Facebook, and let me know how you like this video, and if this is useful, please share it with your friends.